Hi everybody, my name is Angie Hotz and I am a childbirth educator and a birth doula here in Kitsap County, Washington. And today I am talking with my friend Dr. Meg at Chiropractic Lifestyle Center. And she is gonna talk about dealing with moms and babies, because those are the questions that I get the most often. So hello, thank you for doing this with me.
Yes, you're welcome. It's great to be doing this and to be sharing.
You are a great resource in this community. I have learned so much talking to you at the different birth pro meetings and the perinatal task force meeting. It's been great, and so I wanted to share this with everybody else too.
Wonderful.
So to start out with, the thing that I get asked the most by my clients and students is optimal fetal positioning. And one of the big ones that comes up is when a mom comes to me and says, oh my gosh, I'm 36 weeks pregnant and I was told my baby is breech, or I just came from the midwife and they say I have a posterior baby, things like that. They tend to come to me kind of late when they're running out of room a little bit.
Yeah.
It's nice for my students because I catch them a little earlier because it's a 12-week course, and so
Sure.
it's a little earlier, but yeah. So optimal fetal positioning,
Yes.
pregnant mamas with uncooperative babies.
Yes.
How can you help with that?
That's a very good question and a very important question. And chiropractic is well positioned to work with that. Because chiropractic is ultimately about structure and function. So when we have a mom's pelvis that may not be optimally aligned, we can have things that don't work right, that don't function right. The nervous system in particular can be affected. So chiropractic's goal in that situation will be to assess that pelvis and to see where there may be lack of motion or bones not in the right place, and then correcting that through what we call chiropractic adjustments. And when we do that in a mom that's, say, like you said, 36 weeks, wondering, then that affords their structure the best opportunity to work with that baby's comfort in utero. So many times when we get adequate nerve flow to the pelvis, to the baby, babies seek optimal comfort. And they either, if they're head up, they go head down. If they're in a transverse sideways position, they will shift because there's more space and there's more function for them to do that. So I say it's never too late. It's never too late to work with helping a mom and baby and encouraging that optimal fetal position.
When is a good time to start? If you could have them all come in at like the perfect time. When is a good week to?
My experience would be before they're even pregnant. That way we can address all the traumas that may have occurred in their life, all the car accidents, the sports injuries, the repetitive twisting motions they may have in their job. And we can get that pelvis really structurally solid and sound, and the nervous system. So that then the hope would be they wouldn't go on to have either positioning issues with the baby or even common discomforts of pregnancy themselves.
So I think about it as in starting that environment early instead of trying to correct and create it when there's not a lot of space and there's not a lot of room for baby.
Yeah, absolutely. That's the ultimate goal. Would be that.
So what does it look like when a mom comes in for an adjustment? What are some things what does it look like for somebody who's never been to a chiropractor before?
It looks like a lot of connection, first of all. What is it that you're wanting out of this visit? That's always foundational, because I may have goals, but they're not that mom's goals. So first of all, what do you want in your chiropractic care? And commonly it is that I want relief from the discomforts of the pregnancy. That's probably number one. I want to get rid of that sciatica and hip pain, or I want to deal with that reflux, or whatever the symptom is. So it looks like a lot of history taking, a lot of chatting and understanding them as a person, not just as a hip pain or a reflux symptom, but what's going on in your life.
That's refreshing.
What are you doing, day to day? Your physical motions, your emotional health. What are you eating, drinking, or not eating, and those sorts of things. How are you sleeping? All the things that would go into a healthy environment. And that's the big part of the visit. We allow lots of time for our pregnancy appointments so that we don't feel rushed to get at those pieces. And then from there, we go into the evaluation, assessment, that portion of the visit, which is a lot of observing, watching them stand and walk and bend and just raising their arms up. You know, where are the restrictions? Where is it not working right? And then linking that history, if there is one of that area that's not working right, to help create a picture of what's happening in that mom. Yeah, and it's a lot of fun.
Yeah.
It's a lot of fun.
I bet.
Yeah.
I think it would be a really neat experience to look at the body from that perspective.
Yeah.
Yeah, put it all together.
Yeah.
So I hear, and I've had the Webster Technique done. So what is that? And do all chiropractors know how to do that?
Yeah.
Is it something you're trained to do in school, or is it learning that you do after and specialized kind of stuff? What is that?
Yeah, great question. Well, the Webster Technique is a very specific chiropractic analysis and treatment. And it focuses on the pelvis. So what its goal is to uncover any restriction in the sacroiliac joint or the sacrum or tailbone itself, and thereby address that to reduce any type of biomechanical dysfunction in that mom. And so it is a very specialized technique. I didn't learn it in my chiropractic education. I learned it after I graduated and became interested in working with moms and doing a pediatric practice. And I did have the good fortune to learn from Dr. Larry Webster, who was a chiropractor that founded the technique.
That's so neat.
Yeah, I was at a training and I was actually pregnant with my second son, and he was demonstrating the technique, so I was the model in front of all the chiropractors, and it was really wonderful to have learned from him. And so it is a specialized thing. It's fairly basic. There's nothing really complicated about it. It involves laying a mom face down, and we have drop-away table pieces, so they go on the belly, yeah. And you flex both knees, heels to buttocks, and you're finding where the resistance is. And then you're adjusting, correcting that resistance side, and then you're doing some round ligament massaging front on the opposite side. So you're taking any torque and twist out of muscles and ligaments and bones and balancing it. So it's all about the pelvis.
Are there things that you recommend moms to do at home, or different movements to do or not to do, as far as, I don't know, maybe the way they're sitting, or you mentioned the round ligaments, and I thought, oh my gosh, that's such a huge thing. And
yeah, there are things, and the biggest one is a torqued, twisted pelvic position. So that could be standing or sitting, or it could be their job. So, like we're sitting here,
like sitting, and
we really want to avoid sitting like this if we're pregnant, or anytime really. So we encourage a lot of postural education and get the pelvis lined up. Same thing with sleeping, you know, if they can get on one side or the other and get the pillows and all of that so their spine is in alignment, that helps. And then if they're working and pregnant, helping them to modify so they're not repetitively twisting.
Okay.
So a classic is a checker at the store, where they're taking the items off the conveyor belt into the bags. And that's a lot of repetitive torque and twist.
Okay.
So things like that we coach and educate on.
Okay.
Yeah.
Yeah, you were mentioning it, and I was like, oh gosh, how am I sitting? And
Yeah.
made me think.
Yeah.
So I'd like to talk about babies too.
Sure.
After you have your baby, some of the things that I get asked about and see, especially at the postpartum doula appointments, moms will say things like, you know, my baby will nurse on the right side, but not the left side. And I've heard that chiropractic can help with breastfeeding issues.
Yeah.
And then what does it look like, an adjustment on a tiny little brand new human?
Yes.
People worry about that.
Yes,
it's going to be jarring and...
Absolutely. That's, I think, the most important thing to me, is to help parents, pediatricians, OBs, midwives, anybody in the birthing world to capture a sense of how safe this really is for children. So just a word on that, and then I'll give some more specifics. But the safety with adjustments on babies and children is an excellent record. In over 120 years since chiropractic was founded, there's never been a malpractice claim brought against a chiropractor for adjusting a child and having something happen. So that's a pretty good track record.
Yeah.
And also, chiropractors' malpractice insurance rates are the very lowest of all primary health care providers because it's just that safe. So we just rarely pay anything a year compared to some of the other professions out there. So safety, it's very, very safe. So in working with babies, first of all, it's a lot of fingertip assessment, as well as like in the pregnant mom assessment, it's a lot of just observation. So taking the baby doll here, it's a lot of just getting to know that baby. So if it's a newborn, we're going to be just making that connection with the eyes, with the mouth, and then just getting a sense of their structure. Are they open or are they all bunched up? Do they have one arm held tight and the other open? So looking at a lot of symmetry is a very big part of chiropractic. And so your question about breastfeeding, so that comes into play where if a baby has a restriction in the cranium, one of the head bones from birth, or in the neck, which is the most common areas when they have a breastfeeding issue, it may be that they can't quite turn their head all the way one way or the other. So the question of can they nurse equally well on both sides gets asked for that reason. So if they're unable to turn their head fully, that may be a chiropractic adjustment to the cranium or the cervical spine that can then help them turn their head fully so they can then nurse equally well on both sides.
I see births, if a baby is asynclitic coming out, or I mean, you can see the molding on the head, and you know that their journey was just a little bit sideways, just a little bit more, a little harder for them coming out. And I always think and wonder what their breastfeeding journey is going to be.
Yes.
As far as just loosening that up and the adjustment afterwards.
Well, it's really great to be linking that because that goes back to our structure, what that looks like after birth and function. How's it going to all work? So the actual adjustments, I'll just show like a hold might be like this at the base of the skull, and a gentle lift to allow space for the head to kind of come off that first cervical vertebrae. Because in the birth process, it's been estimated there's about anywhere from 60 to 90 pounds of pressure on the head of a baby in any birth. More when instruments are used. So that's a lot of pressure. So just this is like, babies are like, oh, thank you. They can be crying and fussy. So again, this would be a treatment for crying, fussy, colicky babies. It's just getting that lift, getting space, allowing the cerebral spinal fluid to pump and allowing them to say, oh, thank you. And then many times they'll settle in just with this and they'll fall asleep, and it's really magical. So that's a lot of it. And then the other part would be assessing all the bones of the cranium for their movement and their position. So it would look like for the frontal bone here, a hold like this. Assessing the movement. So this is cranial therapy. Temporal bones are on the sides of the heads, on the temples. So we would use the ear as a little hold to assess that motion. And going through the whole cranium and seeing that everything's working well. And then the actual adjustments, if we need to do those, are just little pushes. Again, fingertips. Some chiropractors will use an activator instrument, which is also nice. I just like my hands, so I just take a fingertip and kind of do my little push. And it may be here in the sacrum where they need a little help. It could be really anywhere, but it's all about normalizing their structure so that they can function properly. I had one other comment on the breastfeeding. So the cranial bones, as they are coming through the birth canal or C-section, either way, there's an overlapping and then a unfolding. And sometimes that gets stuck, and that cranial bone misalignment can lead to a irritation to a particular nerve called the hypoglossal nerve. And that hypoglossal nerve goes to the tongue. And so if a baby can't suck properly, it may not be the latch or mom's milk supply or any of that. It just may be that hypoglossal nerve to the tongue isn't getting a good signal. So the tongue will go in. Yeah, isn't that cool?
Yeah.
So the tongue will go into a little bit of a spasm, and then the baby can't suck.
Okay.
And so we remove that interference to that cranial bone through the cranial adjustment, and now all of a sudden the hypoglossal nerve to the tongue works better. The tongue, now the baby can suck.
Oh wow, I had no idea.
So
that's fascinating.
Yeah.
Because I hear all the time now, does your baby have a lip tie? Does your baby have a tongue tie? And then if the baby doesn't and is still not nursing effectively, where do you go from there? Or maybe they have those things and have the issue that you were talking about. There's just, I don't know, I want to have lots of different directions to point moms in.
Yeah.
Maybe it's this, maybe it's that. And don't give up. Keep looking, keep trying, keep searching for those answers.
Absolutely. Well, that's why you're
That's what I'm here.
valuable in the community. Is, you're heading people down paths to try things. Yeah.
Sending people, yeah. And is that showing the different suture lines?
Exactly.
In the skull?
So that's a fetal skull, so we can actually see the soft spot here, the fontanelle in the front and in the back. Yeah, so we use this to show how the baby's skull is a bit different than the adult, and how there are all those suture lines.
I didn't realize that they went in the front like that. I know about these here, but I didn't realize it came down quite so far. And is that something, and now those all fuse?
Eventually they do, yeah. The cartilage portion will go away and ossify or become bone. However, there is still in the adult, according to most of the research, some little bit of movement. So we can still do this type of cranial work in an adult that may be, say, having headaches or vertigo, or those are common ones that I'll do cranial work with. But
It's so fascinating.
Yeah, being born is a big journey. It is, and it can be very hard on a developing spinal nervous system.
Yeah, and that's something that's been really fascinating for me lately, is to consider the baby's journey and how much they go through and how much work they do to come out, and that it's even in the most gentle butter birth that seems so physiologically normal, it is still a lot of work, and
it really is. And we don't always acknowledge that fully, I believe, because we don't see that. We just see the mom laboring and how challenging that is, but we're not seeing that baby until it's out, and so we can appreciate the full journey of that baby.
Well, I remember taking my kids to the chiropractor years ago, back in the Midwest, and when I was being adjusted when I was pregnant, and they just climb right up on the table, and they're like, my turn, and they just kind of lay there, and it was always so funny because they just sort of melt, they just...
Yes, that's
cute.
That's beautiful. And that's another concern that I've heard with some of my patients, like the pregnant ones, where we'll have a conversation about them bringing in the baby, and they'll be, oh really, how do I do that? What if they don't like it, or what if they're crying? And we take every step to keep that baby close to mom or dad or whoever is bringing them in. And so we may be doing the evaluations with, if you're mom, I will keep that baby with mom, and I won't say, oh, give me the baby so I can examine it. I'll say, oh, let's come in here while you're holding your baby and check. And check. Yeah, and we can check the hips. So we don't have to take the baby away and put it on an exam table. We can do that, and we have little cushions and pillows, and they usually love that. But many times I will adjust the children right on mom's chest and never take them off of them. And so, but usually by the time they're 2 or 3 years old, they can't wait to get their adjustment and jump up on the table. And
they always were happy and just fighting over whose turn it was.
Yes, that's wonderful.
How soon should moms be coming in after giving birth? Because we tell them, don't leave bed for 10 days, stay in bed, don't leave. How soon in that postpartum time do you like to see them? My
answer to that is that ultimately I want to see them when they're ready to come in. So if there's no problems and their labor went well as far as their physical, emotional well-being, and they're doing great, and baby's doing great, latching on, breastfeeding if that's what they're doing, feeding in any way is going really well, then come in when you're ready.
Okay.
And usually that's, for most moms, they're ready to get an adjustment after 2 to 3 weeks. They're like, oh, that was a lot of work. They've been holding that baby. So when they're ready, usually 2 to 3 weeks. But if there are issues, then as soon as possible.
Okay.
So if that mom is really hurting, if that baby's not feeding well or sleeping or crying a lot, those are times when get them in right away, because it may just be a simple fix that then totally transforms the whole bonding experience and the whole dynamic of that early newborn period.
Well, and you had mentioned reflux, and I'm always so focused on birth and the immediate postpartum and, what can we do for mom? And I forget that reflux is a thing and that can be helped. Anyways, coming. Yeah.
Absolutely. Yeah.
About that kind of stuff.
Yeah.
So I'm glad you mentioned it.
Yeah. It's just really being a listener and really hearing what's going on for them and in their family.
Well, thank you so much. Did you have anything else you can think of I'm going through my mental checklist of the questions I had, and I think that
I think we hit the high points, and this was just really an honor to do this with you, Angie, and thank you for inviting me.
Thank you.
Yeah.
Okay, so there will be links down in the description of how to find Dr. Meg and to get to Chiropractic Lifestyle Center and a place for you to ask questions, and all kinds of links for information. Thank you so much for watching, and take care.
All right.
Bye.
Bye-bye.